Money here. Look at the clock. It is 10:38 on this 2nd of March, 2020. And this morning we had a very important meeting this morning with our on-air talent here at Phillipsburg Broadcasting. Of course, if you've been watching the news, Facebook, Instagram, Twitter, all over social media, the topic is the coronavirus. And of course, a lot of positive things are being said, a lot of negative things are being said, a lot of the wrong things are being said. So like I said this morning, we had a little meeting this morning with Phillipsburg Broadcasting to talk about our part in this coronavirus. And here joining me this morning, I got Super Kid. Good morning, Super Kid.
Good morning, G.
You can officially say good morning to you.
Yes, sir.
And also got to say good morning to Sagan. We actually dragged Sagan out of bed this morning.
Good morning. So weird being here so early.
I know. How was the weekend, people? Good?
Very good.
Pretty good.
Pretty good. So let's get right to the point. Of course, over the weekend, all kinds of stuff is popping up on our phones, and I'm getting messages from New York to my phone, which is messages that have originated here, and it's just causing such a
panic, basically.
Yeah, basically a panic about the coronavirus, and a lot of people, you could say, are probably not maybe doing their due diligence, as in when it comes to about this coronavirus, about research, what is true, what is not true, what's being told, what's not being told. So like I said this morning, we had a little discussion about what's happening here in SXM. And we actually came up with, Sagan actually came up with a good idea of us to actually explain to the people exactly what it is. So I think the best person to take over the mic now is, of course, Sagan. She made such an impact this morning of what should I say, about explaining to not just us but to people, the public of.
Yeah, she felt it was her due diligence that she has this information. It doesn't do any good to keep it to herself. Might as well explain to the population out there what the coronavirus is about. I believe she did it a couple of weeks ago on her show. She spoke about it in general, in detail, where to go to find factual information on the coronavirus. And she's gonna explain once again on right now. Here we're gonna talk about it on air, like G said. So Sagan, without further ado, take it over.
Oh, such an introduction. Thank you so much. My gosh. Where's my applause?
Now, of course, you're no medical doctor.
I'm not a medical doctor. I wasn't a medical student. I'm an art student.
But you do read.
And I do read a lot.
Do research.
I do research, and two of my biggest hobbies are biology, nutrition, and psychology. I'll just read about those things nonstop. And when the coronavirus first came into the news, it started in December 2019. I think December 15th, 2019 to be exact. I noticed that a trend happening when these kind of potential pandemics start to arise. We saw it with SARS, we saw it with the bird flu, we saw it with Zika, we saw it with Ebola. And what happens is that there's a global panic. With that panic comes a couple things. One of the things that's unfortunate, depending on the origin of the disease, is racism. And we saw a lot of that when Ebola came around, when people didn't really understand that Ebola is actually pretty difficult to contract. You have to get in direct contact with someone else's blood in order to develop Ebola. And yet it still caused this worldwide panic. Zika, there is this big thing that Zika was going to increase the chances of microcephaly. And when I was reading about it, I noticed that Zika has always been in Eastern Asia. In that region of Eastern Asia, there wasn't any increased rates of microcephaly. There was nothing going on, any correlation between microcephaly. It didn't happen until Zika popped up in Brazil. What happened was, in that particular town in Brazil, a U.S. agency disseminated an experimental bug repellent into a certain town's water supply. That bug repellent was designed to shrink larvae that got into the people's water supply. They were consuming that water, and then all of a sudden they're seeing a high rate of babies being born with microcephaly, which just means they're born with shrunken heads. What happened was Zika also popped up around the same time. Journalists come about not really understanding the science behind it and whatnot, correlated Zika with microcephaly, and that became a whole worldwide thing.
Right.
And it became a problem for us because people were recommending that they don't come to our region, that they don't come to our country, especially if you're pregnant.
Right.
And it was very detrimental to our tourism and our image as a country, and it's only because we are misinformed about diseases. So now again, here we are with the coronavirus, and we're having the same kind of issues. I'm going to tell this to everybody. If you research, look at the World Health Organization and the CDC. Do not get your information from news articles. Do not get your information from YouTube channels, except for one that I'm going to recommend you in a bit. But the CDC and the World Health Organizations are the foremost authorities on diseases that are spread worldwide, what to do, the precautions, the numbers, and whatnot. Just in a nutshell, what the coronavirus is that there happens to be, I think, hundreds of different kinds of coronaviruses. They have always existed. When you get a cold is a virus. It's a type of coronavirus. We never know what type. You have to take a blood test and do kinds of screenings if you want to get specific about it, but we don't do all of that because most healthy adults and children are able to fight off the coronavirus with their immune systems. So that's why we don't go through those extra precautions to see which coronavirus is it. This coronavirus that we see right now is a new strain of coronavirus. It just so happened to have developed in the Wuhan region of China. They suspect it came from an animal source, although they don't know which animal. There's all kinds of speculations. But the unfortunate thing that came out of that is because it happened to come out of Wuhan, China, and it was connected to an animal to human transfer, all of a sudden Chinese citizens are experiencing a lot of racism towards them. You shouldn't be eating funny foods. You shouldn't be getting near me. A lot of people were saying that people didn't want to get near them. Chinese people who were born and raised in England, living in England, are experiencing racism towards them, and they haven't even been to China. So what they had to do, the CDC had to rename the coronavirus. They renamed it COVID-19. Now, it sounds ominous and it sounds scary, but you have to understand it's very difficult to name a new disease because you don't want to freak people out. They didn't want to name it after an animal because they saw what happened after the bird and the swine flu. Everybody's freaking out. The pigs are going to get you sick. The birds are going to get you sick. So they didn't want to name it after an animal, and they also don't know which animal it originated from. And they wanted to take the coronavirus out because people were identifying it as the Chinese coronavirus or the Wuhan coronavirus, and they wanted to do that to try and mitigate some of the racist backlash that this has happened. And by the way, an epidemic, a pandemic can start in any region of the world. Something could happen here and it gets in the news. We wouldn't want people treating us a different way just because we have a new form of the cold on the island. Now, when it comes to the coronavirus, a lot of people are very scared because in the news they're talking about exploding. It's going like wildfire. It's people are catching it. People are dying. These are the facts about it. I don't have the exact statistics, but once again, if you want to get the exact numbers behind it, the World Health Organization, the CDC have them, but somewhere between 81 and 91% of people who are contracted or diagnosed with the coronavirus overcome it. Their immune system fights it. That's what your immune system is for, to fight these viruses, these foreign viruses.
So they recover, basically.
They recover 100%, just a few days, just like a cold. A smaller percentage of that, somewhere around 10%, is considered a moderate case of the coronavirus, which means you're probably going to have more severe symptoms. You're probably going to be sick a little longer. Around 5% is considered a severe case. Now, in that 5%, that means you might need some serious medical intervention, especially when it comes to your respiratory system. You might need to get hospitalized. But that 5% is not fatal. There's a smaller portion of that is actually resulting in deaths. Overall, 98% of people who contracted the coronavirus fight it with their immune systems naturally, like you would with any disease.
Any cold,
any flu. Keep in mind, more people die from the flu worldwide every single year. We're talking somewhere around 100,000 people. So this virus is not near the numbers of the flu. What the world organizations are trying to do is mitigate the spread of it. It's going to spread because cold spread, virus spread. They're just keeping track of it. This is why it's in the news. It's not to make you freak out. It's not to make you panic. It's in order for them to let you know that they're on top of it and they're keeping track as to where it's going and how it's progressing. Now, in the past couple weeks, another thing that happened that might be concerning to people is that the numbers exploded. The numbers of the coronavirus exploded. All of a sudden, all these people started to get diagnosed, and it seemed to come out of nowhere. This is how that happened. When they first identified that this virus was going on, they started doing a physical screening at the airports to determine, and doctors' offices, especially in China, to determine who has this disease. As the numbers slowly grew, it was proving to be ineffective and inefficient to use a physical screening. So what they did was kind of like a correlation diagnosis. So if you have the symptoms and if you were in contact with anyone who was in possible contact of the coronavirus, then you're automatically diagnosed. So that means that the numbers just naturally exploded. So it doesn't mean that it's growing so fast all of a sudden. It means that the same amount of people are still somewhat affected, but it's just we're identifying more people that have
So
it.
if you was in contact with somebody with the coronavirus, they automatically, as a precaution, diagnosed you as having it.
Yes, and not even with. You could have gone through an airport that is connected to the city of Wuhan. You could have been working at a hospital that was treating somebody with it, and you come down and the same symptoms, cough, cold, which could be a lot of things. But if those factors come into play, then listen, you're automatically going to be diagnosed. We're going to keep an eye on you. There is no treatment, no cure, but they do things to try and manage your symptoms. And then naturally your body fights it off.
Your immune system will fight it off.
Now the people who are...
And also, quick, just to go back a little bit. So you're diagnosed with the coronavirus, but it's not even necessarily with this strain of the coronavirus, which everybody is talking about, which is the COVID-19 you're talking about?
The COVID-19?
COVID-19, yeah. So it's not, it doesn't necessarily have to be that specific strain.
Well, when we're talking about coronavirus right now, I'm talking about COVID-19.
Okay,
so yeah.
So when you're
yeah, if you've been in contact with COVID-19 or in a place that's been in contact with it, and you're showing the definite symptoms of it, more likely than not, you're going to get diagnosed with it if you go to a doctor like, oh, I went to Wuhan or my family just came from this airport that was connected to Wuhan and I've been coughing and sneezing for the past couple of days, then most likely you're going to get diagnosed with it.
Even if you might not.
Now, there's a chance you might not have it. And there's another thing that people need to understand about the medical industry is that medicine is very complicated. The human body is incredibly complicated. And these science and doctors over the past 100 years have done an amazing job of regulating the way that we take care of ourselves. So even though it sounds like, they don't know what they're doing, they're just guessing, what they're doing is actually really responsible because they want to mitigate the chances of not diagnosing you with the coronavirus, and that way they can't track the numbers of it. So that's why that explosion happened.
Okay.
And then I also wanted to make sure to mention that the people who have passed away, the unfortunate people that have contracted and lost their lives to it, what's important to note is that most of those people are immunosuppressed in some way. They have an autoimmune disease, they're elderly, they have a weak immune system, they have another disease on top of it that kind of weakened them. A healthy adult that is feeling fine, if you can beat the cold, you're more likely going to beat the coronavirus. Like I said, 98% of people who've been diagnosed are
And it could also
fine.
be you're taking medication that weakens your immune system for something else.
Right.
Yes.
And that can also lower your immune system. So I'm taking medicine for something else that I'm suffering from or I have an ailment from, and that can also weaken your immune system.
Yes, absolutely. So that I really thought it was really important to just kind of put what's going on into perspective. I think it's important that people don't panic. Of course, you just do the precautions that you would and that we should be doing regardless of coronavirus or not. You should be washing your hands every time you go in and out of the house before you eat. You should be aware of getting in contact with people who are sick. Do not come to work if you're coughing and sneezing and all that kind of stuff. You should be using Lysol in your home, all that kind of stuff. You should just make sure your hygiene is on point, regardless if corona's here or not, because guess what? The flu is around.
It's flu season.
And the flu kills people.
That's right.
This is kind of the same family of illnesses. So I don't want people to panic. I just want people to just kind of be responsible and vigilant for their own information. The best way to do it is stop reading information on Facebook, stop looking at journalists' articles about it. Go straight to the source. Go to the World Health Organization.com. Go to the CDC.com. And if that is too much, like a lot of people don't really like to read, they're more visual and auditory learners, there's a great YouTuber named Dr. Mike, who's a New York physician. And every week he's been doing updates on his YouTube channel. He does it in layman's terms. He explains things very clearly. He tells you exactly where he gets the information from. So you can look up Dr. Mike on YouTube.
Mike?
Mike. Dr. Mike on YouTube. He has like 5.1 million subscribers. He's very popular on YouTube, and he will give you very succinct and factual information as to what's going on with the coronavirus so that you can stay informed, but keep the panic at a low. This is nothing to panic about. Like I said, we had Zika. We're not talking about Zika anymore. We had the swine flu. We're not talking about the swine flu anymore. I have a feeling that by this time next year, hopefully, we won't have to be talking about it because it will be mitigated and under control. And the authorities are working on vaccines. They're doing everything that they can to make sure it doesn't spread as fast. If we weren't doing what we're doing right now, this would have exploded.
Now, one thing you see a lot. I traveled last week, and some people traveling this week. You see a lot of people wearing masks.
Yeah.
This is something that's, I think, kind of gotten out of control now because you can't even get masks anywhere to buy masks. It's just, people are just buying masks, but there's also kind of like a misconception about that.
Yeah. So the mask thing is a problem, and actually Dr. Mike talks about this. The mask issue is that there's a limited supply of masks in the world. And when you have 7.5 billion people freaking out over the same virus, the mask supply goes out of stock. This is problematic because the mass population does not require masks. The people who do need masks are health practitioners, people in hospitals, people who are in and out of contact of diseases all the time. They need masks. The problem is that if we're taking the mask off the shelves, doctors, nurses, health practitioners, other patients who absolutely need this to make sure that they're not transferring this disease and other diseases do not have what they need. And we've already heard instances of hospitals worldwide that do not have access to masks right now.
Even locally. So make sure that you do not purchase a mask. It's not necessary. The best thing that you can do, wash your hands, and also watch touching your face, because how it's contracted is through the mucous membranes. So your mouth, your eyes, your nasal passage, that is where it comes in through. So make sure that you're vigilant about your own hygiene, your family's hygiene. That is the best course of action. Having a mask is not going to mitigate your risk of contracting because the people who have masks are the ones who actually have the coronavirus. They want them to wear the mask to stop spreading it.
Yes.
Right. To stop spreading it.
So wearing a mask does not necessarily stop you from getting the coronavirus.
No, not at all.
No.
Not at all, because don't forget, at some point you're going to take the mask off, you're going to touch your face, you're going to drive your car, you're going to touch your face, you're going to eat your food.
You're going to go to sleep, whatever.
You could wear a mask all day. If you're not washing your hands and watching your hygiene, that mask is not going to do anything. So stop buying the masks off the shelves. Do not be in a panic. This is nothing to panic about. It's something to be aware of. It's something to keep on top of. It's something to keep yourself educated about. But it's not something that we should be panicking over.
Another misconception, Sagan, that a lot of people have is people coughing and sneezing and everything, and then they're saying, "Oh, I'm not going to send my child to school. I'm not going to work. I'm just going to stay at home so I don't catch anything." Now, people have to remember also, this disease is not airborne, so it's not airborne. It's only basically, like Sagan said, contracted through your mucous membrane, and it's spread through the, let's say, droplets. So let's say if somebody does cough or does sneeze. I saw the same Dr. Mike, he was talking about it. He says the person has to be at least within 2 feet of you, and they cough and sneeze for you to be susceptible to even catch it. And even if that does happen, the risk is not very high of you catching it still.
Exactly. Don't keep your children out of school. Don't disrupt your child's education because somebody sneezed. Because a sneeze could be a signifier of a million things. It could be coronavirus, or it could be they have dust in their nostrils. And you don't want to freak out and keep kids out of school. When you should keep a child out of school, or when you should not go to work, is when you are sick. So you stop the spread of it. So if you're feeling ill, you're feeling sick, do not go to work. go to the doctor and describe your symptoms and be very clear about what you're experiencing and get treatment for it ASAP, because the onus is on you if you're sick to make sure that your community doesn't catch whatever it is, whether it's coronavirus, flu, a cold, whatever it is.
And you mentioned there's no vaccine. So how does one, because that's what we're not hearing. We're hearing about how people are contracting it, where it's coming from, but we're not hearing about the recovery rates and also what to do. Let's say if you do contract coronavirus, what are the steps that one should take?
Okay, so the vaccine, they've been working on a vaccine since this first came about. As you can imagine, developing a vaccine doesn't happen overnight.
Nope.
And to make sure that it's safe for public consumption, there's going to have to be a lot of testing and stuff. So it's going to take time, but they are working on a vaccine. What was your other question?
Let's say if you do contract some type of coronavirus, how do you treat yourself?
First of all, you wouldn't know. Essentially, if you look at the symptoms, it feels like a cold, it feels like a flu. What you would do is, if you're feeling any kind of those symptoms and you're concerned, you have to go straight to your general practitioner. Make sure that you are keeping your hands clean. Get those little Lysol wipes for your car and for your home, for your doorknob. Go straight to the doctor if you're feeling ill. A couple weeks ago, I had a horrible, I don't even know what, like flu, cold, something. First thing Monday morning, I was in the doctor's office. And the doctors are being very vigilant too. They're asking you not to stay in the waiting room if you have a cough. Just please wait outdoors, and then they'll come get you. So medical practitioners are being very vigilant. But again, if you're coughing, you're sneezing, you're feeling sick, do not think that there's a chance you have coronavirus and get embarrassed over it and not seek treatment and not tell. Go to the doctor. That's the best thing you could do for your community, is go to the doctor, stay out of work, keep your kids out of school if you think they're sick. And that's 100% the best thing you could do.
Yeah, and you take care of it basically like you do any common cold or flu or whatever.
So they treat the symptoms. There's you can't really cure a virus. So there is you treat the symptoms. So there are things you can do to alleviate the symptoms, but you do the same thing as you would do when you get home. Get a lot of rest, stay away from people, drink a lot of fluid, and just take care of yourself. But do not panic. I cannot emphasize that enough. We are not in a situation where we need to panic.
Yeah, so... Well, thank you, Sagan. It's been very informative. Super. Thank you very much.
You're welcome.
Just trying to keep the people here in St.Maarten informed. And it's, like we said, there's no need to panic and go crazy. It's a virus. It's something that, it's a flu. It's a different strain. But it's something that we can fight. There's no need to go crazy and go panic and buy masks off the shelves and basically blackball ourselves when it comes to our island.
Yeah.
There's no need for that.
I do want to say again, I'm not a medical practitioner, so if there's any doctors or nurses out there listening, if there's any facts I might have skewed, or if you have anything to add, either hit us up on Facebook or reach out to me in my email at saganspeaks@gmail.com.
That's right. And what are the sources again that people could check out?
Yes, very important.
Okay, 3 top sources that I rely on: CDC, the Centers for Disease Control, the World Health Organization, and if you want something a little more easy to consume, there's Dr. Mike's YouTube channel. Just look up Dr. Mike on YouTube, and every week he gives updates on the coronavirus, and he informs you thusly. He tells you exactly where he gets the information from. He is, in fact, a physician, and it's an enjoyable watch. It's a fun video to watch. Yeah.
Cool. Check it out. Thank you, guys.